Imagine a drug molecule, small, powerful, but fragile, trying to survive the journey through the human body. It faces enzymes, pH changes, barriers, almost like an explorer trekking through a harsh landscape. Now imagine if we could build that explorer a custom-designed vehicle, one that protects it, guides it, and releases it at the perfect moment. That's exactly where PLGA copolymers enter the story. Today we'll explore how customizing PLGA at the molecular level unlocks entirely new drug delivery possibilities. To start our journey, let's meet the main character, PLGA, polylactic-co-glycolic acid. Why does nearly every controlled-release system, from cancer injectables to long-acting antibiotics, use PLGA? Because it's FDA-approved, biodegradable, tunable. But here's the twist. Not all PLGA is created equal. The magic happens when we customize it. When most people say PLGA, they imagine a single polymer. But think of PLGA more like a recipe. And just like a recipe, small tweaks dramatically change the final dish. The lactic acid, glycolic acid ratio, the molecular weight, the end group capping, and even the polymer architecture, linear, star-shaped, block, act like ingredients. Each tweak fundamentally changes how the polymer behaves in the body. Let's talk ingredients. PLGA is made of two monomers, lactide and glycolide. Here's the key insight. More glycolide equals faster degradation, more hydrophilic. More lactide equals slower degradation, more hydrophobic plus crystalline. So if you want a drug to release in a week, you might choose 50-50 PLGA. For a month-long release, maybe 75-25. For ultra-slow release, 85-15 or pure PLA regions. This one decision alone changes the drug's entire journey. Next lever, molecular weight. Think of molecular weight like the thickness of the walls in a fortress. Lower molecular weight, 5 to 20 kilodaltons, walls break down faster, short-term release. Higher molecular weight, 50 to 100 plus kilodaltons, walls are strong, slow, sustained release. In real-world labs, formulators often experiment with multiple MWs of PLGA to find a sweet spot for viscosity, processability, and release kinetics. Now imagine sealing the entrances of our fortress. That's what end group capping does. You can have acid-terminated PLGA attracts water, faster degradation. Ester-capped PLGA, arrow repels water, arrow slower degradation. A small chemical detail, but it often doubles the release duration. Now let's step into the lab. To create PLGA, chemists use ring-opening polymerization, or ROP. Kind of like opening chain links one by one and connecting them in a precise order. You need lactide and glycolide monomers, a catalyst, commonly SN-octo-2, a controlled temperature environment. Think of ROP as cooking with exact ingredients, heat and timing. If the temperature is too high, the polymer branches randomly. Too low, incomplete reaction. Impurities, unpredictable MW. This is where skilled polymer chemists shine. Once we master the basics, we can get creative. Block copolymers, PLA-B-PGA, give staged degradation. First, the glycolic block dissolves, then the lactic block. Star-shaped PLGA gives higher drug loading and unique release profiles. PEG-PLGA triblocks create thermosensitive gels, liquid at room temp, gel inside the body. These architectures aren't just chemistry tricks, they solve real clinical problems. Injectable gels for localized cancer therapy, long-acting ocular implants, 6-month hormonal depots. In actual drug delivery labs, customization is a dance between polymer synthesis and formulation. Formulators think about solvent compatibility, DCM, ethyl acetate, acetone. Drug-polymer interactions. Hydrophobic drugs often prefer high lactide. Viscosity during processing. Scale-up reproducibility. Residual monomers and catalysts. Desired release curve, burst versus sustained. This is the part that separates academic concepts from real, manufacturable drug products. We've come a long way from simple microspheres. The future of PLGA customization includes hybrid copolymers combining PLGA with lipids or peptides, smart PLGA nanoparticles responsive to enzymes or pH, AI-driven polymer design predicting exact release profiles, microfluidics for precision particle engineering. PLGA isn't just a polymer, it's a platform. And as we continue customizing it, we unlock new frontiers for treating cancer, infections, brain disorders, and beyond. Thank you for joining the journey. Now you know the science and the art behind creating custom PLGA copolymers for novel drug delivery systems.